Hey, what's going on everybody, and welcome back to the channel. So today I want to talk to you about 5 anti-inflammatory foods that can help with neuropathy. Now here in my clinic, we are boots on the ground treating neuropathy every day, whether it's from diabetes, chemoradiation, alcohol-induced, autoimmune-induced, injury-induced, whatever it may be. We're here helping people actually reverse this chronic disease. And I want to share with you just some tips and tricks that you can do to actually help start down the path to recovery when it comes to peripheral neuropathy. Now, this is a very complicated disease and it does take a lot of work. We tell our patients expect anywhere between 9 to 12 months in order to start seeing the reversal signs and to get to where they're back to normal function. That doesn't mean that it takes 9 to 12 months in order to start seeing resolution in their symptoms, but when we're talking about getting back to normal function of the nerves and the nervous system, that's what we tell them to expect, because there is no magic pill when it comes to this. But if you're very diligent about being proactive towards it, then there's no reason you can't get great results. So please like, share, and subscribe this video. It helps my channel out. It helps me reach more people, because my mission is to help as many people as possible overcome their chronic health conditions, and neuropathy is just one of them. So with that, what I'd like to do is talk about some different signs and symptoms of neuropathy. So some people may not necessarily know that they have neuropathy. And what we see with this is that typically it looks like burning, tingling in the feet or in the hands. It can be associated with numbness, so people who can't necessarily feel their feet. One way to test this is take a cold pack or take something warm, place it on your face, and then place it on your foot and compare it on a 0 to 10 scale. 10 being normal on the face, as long as you're not having burning, tingling, numbness in the face, and then compare it to the foot. And if you have any deficit, then that could indicate that those nerves are dysfunctional or that there is an issue going on. And so you can do that with pain, you can do that with light touch, and you can do it with vibration as well. And if there are deficits between your face and your feet or your hands, then it may be of concern that you have neuropathy, because that is the nerves being affected by something. And if you haven't watched one of my past videos about the differential diagnoses that we go through with neuropathy, I highly recommend that you check that out to see if that resonates with you. Now, when we're talking about treating this, then diet is a very key component. No matter what the cause is, reducing inflammation is a #1 must. And so typically that looks like cutting out all of your inflammatory foods. That looks like gluten, your simple sugars, smoking, definitely cut it out even though you're not eating. Smoking is a non-negotiable. Alcohol, that doesn't mean that you can't ever have alcohol, but if you're drinking 1 to 2 drinks a night, you really need to address that, because that can rob you of B vitamins and cause it. And then also just avoiding your simple sugars as well is a must. So now you're probably wondering, what are the 5 foods that I can do to help with my neuropathy symptoms? And so the #1 is turmeric. And this is a bright and yellow spice that contains curcumin, like in yellow mustard. And it's a powerful anti-inflammatory compound that has been shown to reduce pain and inflammation in neuropathy patients. So you can try adding turmeric to your morning smoothie or sprinkle it on roasted vegetables, and that can help boost that anti-inflammatory purpose. Now, it is found in yellow mustard, so if you're having like cramping in the legs, then what I tell some of my patients is apply yellow mustard to your tongue. If that takes the cramping away, then it could be that is just due to so much inflammation in the legs, and that turmeric can counteract that. Now, #2 is blueberries, and these tiny berries are packed with antioxidants and anti-inflammatory compounds that can help reduce inflammation and improve nerve function. So you can add them to your morning smoothies, or you can snack on them throughout the day. So With that, any type of berries are generally very good, but if you have diabetes or if you're pre-diabetic, you want to be careful about consuming too much simple sugars. While it is a natural form and most of the time you're getting the fiber with it to help control that insulin response, you still want to be aware of if you have blood sugar issues, or if you have insulin resistance or anything like that. You want to be careful of consuming too much of those. And then number 3 is fatty fish. So fish like salmon, mackerel, and sardines are rich in omega-3 fatty acids. And these have been shown to reduce inflammation and improve nerve function. So you can try incorporating these fatty fish into your diet at least twice a week for maximum health benefits. I did a video about the Mediterranean diet and how, for a longevity standpoint, the Mediterranean diet is one of the best diets that you can follow. And so go back and watch that video as well if you want some key tips and tricks on how to do that. Now, just a little plug in here, we do have an app that we use to manage a lot of our patients, and we allow people that if they want to try it out, they can try it. There is a fee to try that, and we charge $49 a month, just to be very upfront with you. But if you want grocery lists, shopping lists, laid out meal plans, recipes, and everything, we have it on there, as well as some management tips for neuropathy. Have other programs on there like gut health, weight loss. We have a lot of different programs in our app, which I'm very excited about. But this video is primarily just to try to get you to eating healthier and cutting out those inflammatory foods. Now, number 4 is leafy greens. Vegetables like spinach, kale, and collard greens are packed with vitamins and minerals that can help reduce inflammation and improve nerve function. So you can use these in salads or saute them with garlic and olive oil for a delicious and healthy side dish. Sometimes we find that neuropathy can be linked to autoimmune issues, and so garlic is very anti-parasitic and can help clean out the gut very effectively. So it's one of the supplements that we use in a concentrated form to help get rid of potentially pathogenic bacteria, viruses, candida, or parasites. And so just adding that into your simple dishes can really start to have a very good effect on the body. And the allicin in that is very powerful antioxidant and antimicrobial and antiviral. So I would definitely try adding that in. Now, the last one is ginger. And so whether you eat it with tuna or whether you eat it with sushi, whatever it may be, ginger is something that you can add to a lot of different dishes, especially if you make like Thai dishes. You can add that in. And so that spicy root contains gingerols, which have been shown to reduce inflammation and help improve circulation. And circulation, we find in about 80% of our patients, is the main key component. And I tell most of my patients, imagine if you weren't able to breathe or eat, what would happen? You would die, right? So that's what we find with neuropathy, is that a lot of these nerves are starving for oxygen and nutrients, and they aren't getting what they need to survive. So by adding this into it and helping improve the blood flow, that is a very key component in order to getting the blood flow back to those nerves so that they can heal. So you can try adding the fresh ginger to your tea or using it to flavor your stir fries, like your Thai foods, for a healthy and delicious boost. So incorporating these anti-inflammatory foods into your diet can not only help reduce inflammation and alleviate neuropathy symptoms, but what you want to do is try incorporating these into your daily meals and see how they improve your health and well-being. Now, it's very important to note that for some people, this may take a very long time. So with just diet and nutrition alone, it's probably going to take you 3 to 5 years, especially if this has been going on for years, because the longer that you wait to do something, the more compounding effect that you have on the damage on your body and the nerves. So being proactive is very key in this, and I can't stress it enough. Just because you don't necessarily feel very bad now, if you're having symptoms, if you're having tingling in your feet, your hands, burning, numbness, you really do need to address it, because we see people all the time that come in wheelchairs or walkers or with canes, and they are very stressed out, and they're so, you know, they're so worried about what their future looks like, and they want to address it, and they wish they would have been more proactive. So just speaking for them indirectly and from what we see here in the clinic, take care of yourself, be proactive, do what you need to get better, and just supplement these into your daily routine. An 80-20 rule is generally what I tell people to follow. And so, you know, that looks like if you're eating 5 meals a day, 4 of them should be very healthy, and you can always have a snack, but you also want to make sure that you're exercising and doing those things to stay healthy. So if you need help with this, please reach out to us. We have a bunch of different resources that we can use to help you achieve your goals. And we just had a patient get off gabapentin that they've been on for 3 years. So what we do works. So thank you so much for watching. Please like this video if you found it helpful, share it with your family and friends, and subscribe to the channel. All right, everybody, I'll talk to you later. Bye-bye.